Hi everyone. Well, PDB is now upon us with our first lecture tomorrow. It's pretty exciting. Obviously, there's not a lot to tell you at the moment, except I just wanted to go over some of this week's activity and explain to you why they're there and why they're fairly important activities. Starting off with the first prac, that's all about gait aids. Assessing patients for gait aids, prescribing the appropriate gait aid for a particular circumstance, and then teaching our patients how to use the gait aids in a safe and effective manner. That's a very important thing to do, and it's a skill that you will be using a lot, both in clinics and in your future career. I remember the lessons that I learnt when I was in your position now. And it just stays with you. So it's a really important skill that you'll take with you in your career. This second prac is equally as important, and that's about assessing a person before we get them up and mobilise them. The patients might be recovering after an operation, and we're not sure exactly what they're capable of. So we need to do some screening tests to sort of assess their capacity before we get them up. If we don't do this, we're courting disaster because they get up, not have the strength, and just collapse down on us. So it's really important to fully assess everything that the patient needs to do and have our routine for mobilising a patient for the first time after an operation, getting that routine set so we know in our minds what needs to be done and how we can coordinate that whole procedure. So there are two very important lessons in the pracs this week. Then at the end of the week in the workshops, we're going to be looking at ethical situations and ethical dilemmas that are common in clinical professional physiotherapy practice. So you'll be doing some work there, and then we'll be having conversation afterwards. So it should be an interesting time. So good luck for the week, and I'll look forward to seeing you all bright and early tomorrow and then strutting your stuff during the week. Cheers.